Do you have to get internal manual exam with pelvic floor issues is the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy. One of the questions I'm often asked is if internal manual work is absolutely necessary for pelvic floor issues. And the answer, short answer, is no. In fact, this is the reality. Chances are you've had an issue, you've gone to a specialist, and if it was not medication or surgery, they refer you out to a therapist for pelvic floor. Most often, the therapist practices kegel or works on the trigger points in the muscles inside of you, and then that's it. The reality is the kegel exercise, you don't need to necessarily have someone monitoring it, though it may be helpful, maybe for a few sessions, so you better understand how to do it. In my office, we actually, when indicated, we have a machine called emsella. We're gonna put the note in the description box, a link about it so you can read about it. But emsella does 400 kegels a minute. So we don't mess around, let's just get down to business and take care of it. Because if we can strengthen those muscles at the right time, then you doing the kegel exercise on your own is more possible because the body already has what it takes to do it. So the description and walking you through can help you do that. We don't necessarily need to go in to see if you're doing it correctly. But there are deeper muscles like your obturator internus that we can address, or there are other muscles of the pelvic floor that we can address, that we can work on with the trigger points. But from the outside, we can work on it to some degree. So from my perspective, in many pelvic floor issues, you don't even have to go and have the internal work done. In others you do. And pelvic floor dysfunction is a lot more than just incontinence or weakness of the pelvic floor. I've done a whole blog on what pelvic floor dysfunction is. We're going to make sure we put that link in the description box as well. But pelvic floor dysfunction is so misunderstood. You really need to be very careful. If you have incontinence or issues that you're about to have pelvic floor done on the, or work done on the inside, you have to understand that this may be one of the many symptoms of pelvic floor dysfunction that you're totally being oblivious about because your doctor that referred you to a therapist is not an expert in recognizing that either. So it's very important who you see does a thorough assessment to see what other signs and symptoms of pelvic floor dysfunction you have in addition to the incontinence that you may be suffering from. So I hope that this helped. If you have any questions, use one of the methods of contact in the description box to contact me. And if you need help, just give us a call. Thanks for watching. Take care.